Got an excellent question emailed in with some photographs from a woman in her mid 50s where she thought she needed a tuck behind the ears or a face and neck lift, but she had a procedure by a different doctor and it was lipo and laser. And now she's been left with what she feels is pretty saggy skin, and what's on the photographs is some neck banding and some looseness of the skin, and wanted to know what could be done about that. Well, first off, we don't know how long ago that procedure was done, so I would say it's time to recover from that fully. But I have a feeling in this case, from the information that was sent, that the person was, again, kind of shuttled into a procedure that the particular person wanted to do, the doctor may have wanted to do, but might not have matched the person's anatomy, and you have to be careful. The person does mention in this question that the doctor was not a plastic surgeon. That does not mean that they don't know how to do face and neck surgery. I don't like to say those things about other specialties, but in general, if you consult with somebody that is fully trained and does the full array of the procedures for the area you want to do, then you are more likely to get a recommendation that is going to be in your best anatomic interests. There may be different options there with pros and cons of each, as opposed to somebody trying to fit you into the procedure that they do. You have to be a little careful. So for this lady, the good news is I think things will work out for her. Once things have recovered, I would recommend in this case doing a neck lift procedure, because if there's looseness of that tissue, the procedures that she had are not going to address that problem, and that's going to leave you with a neck that doesn't look as good as the face, and usually you don't want that situation. If the neck needs work, usually you do it at the same time as the face. It doesn't always need to be done, but if it does, you want that pointed out to you at the consultation so that you can select with the doctor the right procedure that's going to work to address the complaints that brought you to his office in the first place. So I hope that helps, and we will look forward to seeing you on the next question.